Good morning. It is Monday, April 7th or 27th. I'm Bob Ravenscroft, the Vice President for Advancement here at Bryan Health. With me today is John, the Chief Executive Officer of Bryan Medical Center. Before we get into today, just tomorrow, we are going to have one of our employees, one of our first COVID patients here at Bryan, who is now fully recovered, give you the perspective of what her 4.5, 5-week journey dealing with COVID was and what it means to come back to work. So we look forward to having that person present to you tomorrow. So we're going to share the numbers as we usually do. John will talk about the next steps for the mobile clinic, which will be, again, going down to Crete, Nebraska. Talk a little bit about our plan for electives coming back up. I know you've had questions on that. I mean, a lot of things are being planned right now, not only the blood and the PPE that we've talked about, but we know that there will be more people in the building, but yet no visitors. What type of screening needs to take place? Short-term parking for discharge. All kinds of things are going on behind the scenes. And then, of course, answer your questions as well. Our daily census as of midnight was 371 patients. Through our Bryan Easy Visit vehicle, we have now screened over 10,972 people, resulting in 3,463 easy visits, and 1,623 have used the COVID promo code. Lots changed over the weekend. Collectively at Bryan, we have now tested 2,718. We have 202 positive results. 2,372 negative results, and we have 144 pending. Since Friday, when we last spoke to you, we have tested 362 individuals. So there you go, John.
Thanks, Bob. John Woodrich, CEO of Bryan Medical Center. So currently we have 8 positive COVID patients in-house. 3 are from Lancaster County, 5 are from outside. We actually have no pending cases in-house. 3 of those individuals are on ventilators, 4 are in our ICU unit, 2 are in our progressive care unit, and 2 in our general care unit. I thought I'd talk about our mobile screening. We're going to go to Crete again Tuesday, about 3:30 in the afternoon to 6. We're working in conjunction with the health department and have to thank the city of Crete, who's going to allow us to go to the city utility shop. This is on 9th and Oak. I'm not that familiar with the neighborhood, but people say it's right behind the food mart, so most people will know where that's at. They'll have accommodations for parking, and it'll be just like the other one. We call it a walk-up clinic, but we want you to go and register by appointment through our scheduling center, and that number is 402-481-5121. And maybe to just give you a breakdown, we had 78 patients go through the mobile last week. 33 were positive. That's a 42% positive rate. 44 were negative, and 1 we are still pending. So that just kind of confirmed what we believe was happening. But we think our next step to this is, as a community and as we take care of individuals, do a deeper dive and see the living conditions and how these people live together. Oftentimes you'll see multiple generations in the same home. So, you know, as you relate this virus and you talk about the facility or the place that they work, more importantly is how we educate people on the social distancing and maybe how we separate folks from the elderly or individuals that are compromised. Remember, a lot of people can get COVID, but it's the people that are compromised from a respiratory condition or asthma or something of that nature that are the ones that become more severely ill. And those are who we're trying to protect even more so those people don't end up in a hospital or on a ventilator or in an intensive care unit. So all that we were able to identify here is that we knew there were going to be a lot of positives. They are existing. Now what we have to do is take those next steps of how do we work with social workers and individuals and caseworkers that could help these families and let them understand the importance of self-isolating for these 14-day periods. So that's where the real work begins. So as we go down there on Tuesday and get another sample size we could take up to another 160 patients during that 2.5 hour period, we hope to do additional work to help the spread even further. I did want to share with you a little bit more about our elective surgeries, and as we start to gradually open up the capability of doing that, we're working with our medical staff, and we'll have one more meeting tonight to just kind of put the final bow on it. But the approach that we're going to utilize right now is if you are a relatively healthy person that needs to have an elective surgery done, those are the ones we want to prioritize first, in that you would not have an overnight stay of more than 1 day. And we'll monitor that for about a 2-week period, see what that does volume-wise, use of PPE, blood utilization. Then we look to open it up to patients that need to have elective surgeries and some other inpatient type surgeries that would go up to a 48-hour length of stay or a 2 overnight stay. Monitor that for a period of time, see how we do there before we would call it really opening it up to any other types of surgeries. We're doing this same thing with procedures in the hospital, or what you might say diagnostic test. We're taking a gradual approach to these as we continue to open up to make sure that we have the proper types of equipment and so forth throughout the organization. I think Bob mentioned to you, as we have more individuals come into our facility, I want to reemphasize that we will not allow visitors into the organization unless there is a special situation. We also understand that when people will drop someone off here to have a surgery or have a procedure, that more than likely they're going to probably be waiting in their car. So we're going to have a designated parking area for those individuals. We'll have a connection point with them, so we'll ask for information like cell phone numbers, so that when people are being discharged, it'll make it convenient and easier to receive their loved one back, and also maybe at that time give instructions for discharge to the other individual that may be waiting with them. So we're making those type of adjustments as we look forward to opening this up, probably the beginning of next week, unless things change to where we don't have that capability to do that. With that, we'll open it up to any questions via chat.
Maybe something to just reinforce with what John said. When electives open back up, there will still be an element of screening involved. There will be an element of separation in our facility where the COVID patients are a certain spot, separated from others. And then we'll do everything in our ability to not only make it safe for our employees and our physicians, but our patients as well. So it's going to be, screening, separation, and safety is what's going to really drive us on opening back up. If you've ever been at Bryan when a baby's born and you hear, the lullaby music played, we have a team working on that just to keep our staff up as well, that when a COVID patient is discharged, there's going to be another jingle that's played to kind of celebrate those good things that are happening.
I think the thing that people have to realize is a majority of these individuals do recover. And I think so far in our county, unless the number has changed, I think we've had 1 death in our county. So that gives you some indication for all the positives that we've had. Look at how many people have recovered from this. And that's why it's so important, and we can't stress this enough, social distancing and self-isolation. This is going to stop this from affecting those people that are already compromised. And we cannot let our guard down, and we can't say this enough. I know as you hear of different parts of the state starting to loosen up some things, that's all with us saying we're still going to follow those same rules. We understand that people are being, confined to their homes at this point in time and trying not to get out. And after a while, when the weather starts getting nice, people just naturally start to go outside. But you can't just say we're going to go back to the way things were. We still have quite a period of time to go with this, and we've even talked about our peak period here is still a couple weeks away. So it's really important that we continue to follow the guidance that we've been receiving from our health department and what you're hearing from your government officials. Basically, we're seeing them do some testing there. If there is somebody that is a potential positive, they will be coming to Bryan. We're just better equipped from a facility perspective. We want to assure too that we don't utilize all the PPE that smaller hospital has. And that's kind of the agreement we have with the majority of the critical access hospitals throughout the state of Nebraska. You will see a majority of those patients be transferred to Bryan Medical Center. So we're working with Pat Lopez right now from our own health department, and she's working with specific groups in town, and we're looking at setting the mobile up at centers and getting that notification out. That's still in the works. We have been contacted by other health departments, and it's at the very early stages right now. I think the mobile capability is allowing us to get to populations or areas of communities that people either have a difficult time getting access to having these tests done, and that's the need that we're trying to meet right now so that the additional follow-up can occur with these individuals.